Hello, my name is Kimberly Muñoz Aguirre. The topic is Enterobius vermicularis pinworm infection. Definition: Enterobius vermicularis, also called pinworm, is one of the most common pneumonia infections in the world. Originally, E. vermicularis was named Oxyrius vermicularis. Humans are the only natural host for this infection. Transmission occurs in people who are living in crowded environments and usually occurs within family. The words are tiny, tree-like, and witty. The word is named after the characteristic pin-like tail present on the posterior part of family words.
Here we see a colonoscopy in a 54-year-old patient from Sicily. We just performed polypectomy, and now we see this unexpected guest dancing on the post-polypectomy wound ground. This very vivid white, small and delicate worm is an Enterobius vermicularis, or so-called pinworm. It is the most common intestinal parasite in the Western world and establishes itself mainly in the cecum and appendix. Normally, patients with this nematode infection have a high worm burden. Probably the worm burden in this patient was significantly reduced by the previous bowel preparation.
Application in nursing. Application in nursing maintain the integrity of the perianal skin, assess characteristics of the disposition, and make the record in nursing notes. Assess characteristics of the disposition. Determine the relationship between the onset of infection and the start of enteral feeding.
These are, of course, earthworms found in our surgery flower beds. There are, however, other types of worm that can live and thrive inside our bodies, causing health problems. The commonest such worm is the threadworm, sometimes known as the pinworm. Threadworms are very, very much smaller than the garden earthworm, but are visible to the naked eye. They appear as thin white strands up to a centimetre long, looking like desiccated coconut or threads of white cotton. They are seen around the anus or actually on feces. They can live inside our gut, but come out usually at night and lay eggs on the skin around the anus. Eggs attach by a sticky substance which causes itching. To complete the life cycle, they must reach the mouth of another person and be swallowed back into the gut. This sounds unlikely, but is in fact common. Some people don't wash their hands after toileting. As a result, they may unwittingly have the invisible eggs on their hands or under their fingernails. They can reinfect themselves or pass on the infection when touching others. The cycle is completed when fingers touch the mouth and eggs are swallowed. Threadworm infection is commoner in young children for this reason. They are more likely to have poor hand hygiene and more likely to put their fingers in their mouths. Threadworm infection causes itching, which is usually around the anus and more noticeable at night. Infection can result in marked soreness, vulval itching, discomfort when urinating, bedwetting, sleep deprivation, and irritability. A story of an itchy bottom, usually worse at night, with characteristic white threads on feces, is enough to confirm infection. Lab tests are not necessary. Thankfully, treatment is simple and usually involves a one-off dose of medication such as mebendazole or piperazine. There is little in the way of side effects, and both medicines come in a liquid or tablet form. All family members should be treated, as some people don't show any signs of infection. Specific advice should be sought from your doctor or pharmacist if you are pregnant or if your child is under 2 years of age. After treatment, infection may take up to 2 weeks to clear. During this time, simple measures should be followed to help prevent infection and further spread. Ensure hand washing after using the toilet. Use a nail brush. Keep fingernails trimmed. Bath after waking. Avoid hand-to-mouth contact. Avoid finger feeding. Use cutlery. Wear night clothes or pants in bed. Avoid shaking. Use bed linen, as this may spread eggs. Wash night clothes and bed linen daily. Remember, threadworm infection is really serious. The real key to preventing this infection and others is proper hand washing, especially after using the toilet. Keep clean, keep well.
Pros and cons. Pinworm infestation is common because pale eggs can still be excreted 1 week after treatment and because it's deposited in the medium prior to treatment can survive for 3 weeks. Wash hands with soap and warm water after using the bathroom or changing diapers and before handling food. Frequent washing on clothes, bedding and toys. If people are infected, shower every morning to help remove eggs from the skin. Vacuum the environment with a vacuum to try to remove the eggs.
Testing 1, 2, 3, 4. We are back with microbiology and immunology. Case 43. A 4-year-old boy is brought to the pediatrician because of perianal itching, which is worse at night. He attends preschool during the day, where he shares toys and play areas with other children. The patient's mother recalls her son playing with another child who had been scratching his backside and wonders if there is a connection. What is the most likely diagnosis? Pinworm infection caused by Enterobius vermicularis, a nematode or roundworm. What is the life cycle of this organism? After fecal oral transmission, the eggs hatch in the small intestine. Adults mature in the ileum and large intestine and mate in the colon. Females exit the rectum at night to lay eggs in the perianal area. This irritates the perianal area, inducing the host to scratch. Scratching transfers eggs onto hands, greatly increasing the likelihood of transmission to another host. What sequelae may this infection have? Intense scratching may compromise the integrity of the perianal skin, predisposing the patient to dermatitis or folliculitis due to dermal invasion of fecal bacteria. What test can help confirm the diagnosis? Adhesive tape test.
Use applique in Ecuador. 20% of the population was parasitic, helminths, 82% of the population be protozoa, and 40% present both types of parasitosis of the protozoa. Entamoeba coli had a higher prevalence with 78%, Entamoeba histolytica 40%, and 20% of the population was parasitic by both protozoa.
Or most thousands of essentially comes from an egg. So here we have an egg. This is the infective form. Inside the egg contains larva. The egg itself is about 50 to 60 micrometers by 25 micrometers in width. It's a seed-like, colorless shape and is transparent. When the egg or the larva becomes a worm, the worm can be either female or male. A female worm makes more eggs. A male worm is a lot shorter than the female and helps the female in mating to produce more eggs. So let's see how Enterobius vermicularis causes an infection, causes pinworms in a human body. It's important to know that pinworms, Enterobius vermicularis, is thought to only target humans as hosts for reproduction. So here I'm drawing a human with the gastrointestinal tract because Enterobius vermicularis causes pinworms in humans starting from the digestive system. I'm also drawing a bum here because this is where the female worm will implant its eggs onto, causing an itch-like symptom on this human. So now let's begin and see how a pinworm infection is caused. The first thing that could happen is that contaminated food, water, with vermicularis eggs can be ingested by this human. A small number of eggs may also become airborne and inhaled. Because these eggs are so small, they can be inhaled and they can itself cause a pinworm infection. So these eggs are inhaled or ingested into this human, and the eggs goes down through the gastrointestinal tract to the small intestine. So following ingestion of the infective eggs, the larva will hatch in the small intestines. The larva will become either a male worm or a female worm. A male worm is about 5 millimeters long, female worm is about 10 millimeters long. So here you can see the infective eggs in the small intestines hatching. The larva will become worms. It can become a male worm or a female worm as shown here. Now the adult male and adult female can migrate to the colon, the large intestines, and then mate. The male dies after mating and the adult female begins moving to the rectum area about 1 month later. So here the worms migrate to the colon, they can mate, the female survives. Now, the gravid female will migrate nocturnally outside the anus and ovipost, which basically means lay eggs, while crawling on the skin of the perianal area, meaning that the female worm will essentially go slowly out of the rectum and lay eggs in the bum area.
In conclusion, it is albicel the practice success special tools in the pediatric consultation routinely carry out its implementation in the event of any suspicion of pinworm symptom. This last saying is relevant sign is necessary to demonstrate that in addition to anal int, on clinical level E. vermicularis infection can cause other symptoms that are generally attributed to E, e.g. nocturnal enuresis, hypersalivation. you for attention.